Hello everyone, welcome to my channel. My name is Tamara, and today this video is going to talk about therapy, and I'm going to give a little bit of background of why I stopped providing therapy. So I am a LCSW, I'm a licensed clinical social worker, and when I was doing therapy, I worked for an agency. And for those of you who either do provide therapy or who want to work with an agency, typically they take a percentage of whatever the insurance reimbursement rate is, or even the self-pay reimbursement. But usually, sometimes it'll probably be insurance. You might have insurance and self-pay, but I typically work with different insurances, like all types of insurance. So they'll take a percentage. Sometimes it can be you take 70%, they take 30, they might take 40, you take 60 home. It really just depends. And that's something I want to talk about as well too, because if you want to do therapy, you can either work for an agency, and that agency will typically do the billing for you and schedule your clients for you, versus if you work for yourself, then you're going to have to schedule clients, do the insurance reimbursement, do all that stuff yourself. For those of you who don't mind doing that, then, you know, of course, the pro for you doing that is you get to keep all the reimbursement. You don't have to either give them back 30-40%, because some agencies are different. Some agencies will give you all of the money, and then you just have to give them 30-40% or whatever the percentage is. Or some of them already take the money out and then they give you what's remainder. So a little transparency, that the agency that I worked for, they took out their percentage and then they gave me what was left, which to me is fine. I'm the type of person, like, go ahead, even with taxes, go ahead and take out what take that off. Because I don't like owing people. I don't like owing anything. So that's how it was when I worked for an agency. What else? Okay, so they scheduled clients, but sometimes I would go ahead and schedule clients too. Like if I was in the office and we wanted to go ahead and schedule, I could do that myself. Now, I would say if you work for an agency, I would not recommend you touch scheduling at all. I feel like if you're working for an agency and you're paying them, let them schedule, let them deal with billing. You shouldn't be dealing with any of that stuff. So that's another reason why I left, because I kind of felt like I was paying the agency to do things that I was doing. And it was I'm kind of like, well, why am I paying, So, but if you don't mind doing that, then hey, you can work for an agency. But I didn't like that, and I felt like I could be doing this stuff myself. And a lot of people start off in an agency setting and then they start working for themselves, which I also recommend you doing or whatever you want. But I would say probably start off with the agency first, because you can learn the tricks of the trade and kind of learn how to do things. And then once you feel like, hey, I can do this myself, or I want to do it myself, go ahead and branch off, because you already know what to expect. And speaking of expectations, so if you want to provide therapy, so when I did therapy, that was not my sole source of income. It was a part-time job. But if you want to be a therapist full-time, you have to think about scheduling. Sometimes if you're seeing clients from 9 to 5, I know some clinicians who would see clients back to back, and they wouldn't schedule a lunch. Make sure you schedule a lunch. And then sometimes you're seeing 7 or 8 clients a day. For me, because I used to do that on the weekends, it was just too much for me to see a client back to back to back to back. It was just too much. I'm like, I can't do this, because for me, a lot of the clients that I saw had different issues, different challenges, and to have to listen and deal with that, like back to back to back to back, it was just a lot for me. It was a lot. So I was just like, I can't, I can't. But for those of you who are interested in doing therapy, you can make your schedule however you want to make your schedule. You can work 9 to 2, 10 to 2, 10 to 4. You can make your schedule however you want your schedule to be. And that's independently or with an agency. So whatever you feel works best for your life, you can do that. But for me, I was just like working a full-time job. And at that time, I had started my doctoral program as well. So working a full-time job, having my doctoral program, having my family, having my son, and then doing that on the weekends, it was just a lot for me. I feel like I didn't have a whole lot of time, and I like my Saturdays to be free time. So I spent a lot of my Saturdays, doing therapy. But for those of you who do have a lot of free time or that's not an issue, then hey, you can go ahead and do that. But for me, I was just like, it's just too much for me. And I could make my schedule shorter, which eventually I did end up doing that. But I would say if you are going to do therapy, make sure that you schedule a block for lunch, because you have to eat and just take a break to kind of like decompress. But also too, something to think about when working full-time as a therapist. Sometimes you may have no-shows. Sometimes people may call and cancel the day of, right before their session's supposed to start. And I don't think all insurances provide reimbursement for no-shows. I'm not sure. I know for me, if nobody showed up, I didn't get paid. But I was working part-time, so they didn't really hit me as if I was working like full-time, and that my full-time income was solely on that, then that probably would have bothered me. And also, the agency that I worked for, I was driving 35 to 40 minutes sometimes because it was far from my house. And at that time, sometimes I might have, because you might have some older clients or some clients who just don't like doing virtual. So I had some clients who just didn't like doing virtual. They wanted to be face-to-face, so I would drive to see them. But if you're driving 40 minutes like me, for one client, that client canceled, it's like, oh my goodness, I just drove 40 minutes here, they canceled, and now I gotta drive 40 minutes back. So think about that as well. Think about that, because sometimes you may have, people who cancel, and depending on what's going on, you may not get paid. So you do have to think about that, take that in consideration, that you may not, be reimbursed for your time. So yeah, so just to piggyback really quickly, I'm looking at my notes. So you can either work for yourself, work for an agency. If you want to work for yourself, then you're going to have to schedule all your clients yourself. And then you have to also, if you work for yourself, you're going to have to secure a location, or maybe you're only doing telehealth. But all the clinicians that I know that work for themselves, they have a location, they have somewhere where they do therapy. I would not recommend, I don't even know if it's allowed, I'm not sure, but I definitely would not recommend you having let's say if you have a basement and you can convert your basement to like a therapy office or something like that. I would not recommend that, because you never know what could happen, and I definitely would not recommend that. But if you work for yourself, you're gonna have to 9 times out of 10 find a location, schedule the clients yourself, try to receive your reimbursement from insurances on your own. But the pros to that is you are able to collect 100% of the proceeds. But if you work for an agency, you have to give them a portion. They should already have a location for you. You don't have to do that. They should do your scheduling. If you work for an agency and they are not scheduling your clients for you, I mean, sometimes maybe once in a blue moon you may have to do it, but I'm sorry. Like, this is me though. This is Tamara speaking now. If I'm paying an agency and I'm giving them a portion of what I'm, I I should not have to do scheduling. That's just me. Like, I shouldn't have to touch that. Like, they should be taking care of that for you. They should be doing, I feel like they should be checking clients in and out when they leave. And what else? So yeah, so scheduling, they should also try to get the reimbursement for insurances, which I didn't ever have to touch that. So that's definitely something that they should be doing. Also with an agency, if your agency is not providing like staff meetings, now if it's a small little agency, not sure, but even still, I feel like you should have staff meetings. You should staff clients and talk about certain things, and you should have like just talk about what's going on. And if you're not having that, I feel like that's a red flag, because I would want to talk about what's going on. If you've never seen the person who owns the agency, because sometimes people will have multiple agencies and you never know who the person is, or you've never talked to them, I feel like that is a red flag. Because if I was an owner of a business, especially being a LCSW, right, and if I have my own agency, I want to see who's, because you're representing my agency, so I want to talk to you. I want to see how things are going. If you never see that person, to me, that's a red flag. Leave a comment down below and tell me what you think, but I feel like that's a red flag. So I would definitely try to look for an agency who has a director, or the clinician rather be an LPC and LCSW. But 9 times out of 10, like the director that I worked for, or who owned the agency, it was a co-owner, she was an LCSW. But yeah, you should have someone that's kind of hands-on, trying to see what's going on, help you as well. Trying to think what else. Oh, and also notes. So the notes that I did, So some people, it depends. Every agency is different. Some agencies already have pre-populated notes. I know some clinicians who all I have to do is like click, 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 add some stuff and they're done. My notes were a little bit longer and detailed, but I did a little bit more with my notes, but I guess it really just depends on the agency and preference. I've heard, less is better for if you have to go to court, but for me, that's just me. I'm a documentation person, so I would just document a lot. I would even put in my notes if I saw a client. I'll put a note in saying like, oh, client canceled or reschedule, whatever, and I'll upload that. If a client is consistently canceling and I didn't see them, I think it was 3 times, I'll let them know like, hey, well, the agency would say like, hey, you're going to be taken off the caseload, if you're not coming. And I would document every time a client did not come. I would document calls or they didn't come or they canceled. I would document that because I feel like if anything was to happen, I want to say like, hey, I haven't heard from this person. I didn't know what was going on or whatever. So, just go ahead and document that. For those of you who are in school and you're interested in doing therapy, I would definitely recommend trying to intern with a therapist's office. Try to intern there so you can learn. Because I will say for me, my first job or my first position as a clinician, I had a little kind of bit of experience, kind of, sort of, but not really. But if I would have did an internship with a clinician, learning the ropes, learning certain things, how to do certain things, even though it's not going to be perfect because you're learning, it's not going to be perfect, but just to kind of have a background and kind of know kind of how things should go to a certain extent, I would recommend that if you could just kind of do an internship there. Now, I was in a meeting and it was everybody's take on this is different. That if a person who is not licensed, that they should be seeing clients. But as far as internship, I don't know, maybe if a client will allow you and your supervisor or the person that you're doing the internship with to sit in on a session and maybe you can learn. They allow you to do that. You can learn, you can talk about certain things. Yeah, let's see what else. So again, if you work for an agency, you have to give them a portion of reimbursement, but if you work by yourself, then of course you keep all of that. And also, big thing is no shows. If you're working by yourself independently and you are solely depending on clients to come in to pay your bills and to make your your income and things like that, and they don't come and they cancel, then you're not getting paid. So that's something to think about as well. And also one tip too, because I try to like to end things talking about self-care. When you hear certain issues, certain stories that certain clients tell you, I know for me, some things were just, people have been through so much trauma, right? We know that as clinicians, so much trauma. So something I would do, especially on my ride to work, my 40-minute ride, and this is just me personally speaking on my religious beliefs, I would pray. I would ask God to like protect me, clear my energy, get my thoughts out. Like, when I would drive, I would pray. And I know people, they're like, who is she talking to? I'm talking to the Lord. Don't worry about it. So I would just drive and just ask God, like, Lord, just protect me, protect my mind, shield me, my energy. I pray that I have a good energy. I pray that, you just keep me safe. And just, I would do that on my way there. And then when I would leave, I would pray on my way home too, to kind of just clear my energy and just to kind of help me decompress. And, that's just something I would do. That was a form of self-care for me after hearing certain clients' story or seeing a lot of clients. I just had to kind of pray and just kind of talk to God and just kind of because I have to go home to my family, right? I still have my own, things that I have to deal with. So just remember that with being a clinician in therapy, self-care for yourself, because you're going to hear some things that are very traumatic. So how are you going to deal with that? How are you going to be able to kind of declutter the day and kind of just calm down and go back to your life, So anywho, I hope this video helped you all. I am so sorry I have not been posting like consistently on my channel. School is out, so I've been playing catch up and things like that, but I'm going to post some more videos. Please leave me comments down below. Please subscribe to my channel. I'm trying to grow my channel. Also, let me know if you would like to see a day in the life. I am helping out doing summer camps in schools this year. This summer. So if you would like to see, well, I can't really show you a whole lot, but if you want to see a day in the life video, let me know. And let me know, are you a therapist? You know, it's something that you want to do. Did I leave out some things that you're like, I want to know about this, I want to know about that? Leave me a comment and I promise you I will respond to you, okay? I hope you all have an awesome day. Thank you for watching and I will see y'all later.